in Jamaica. I left Jamaica in 1986. I come home 3-4 times a year.
Okay, so you're through and through Jamaican.
I am through and through Jamaican.
All right. Okay, so nurse, tell us first of all, how is it that you came to be the first person in the U.S. to take this vaccine? Were you approached? Did you volunteer? How did it play out?
So I volunteer after seeing so much despair, death, suffering, and pain. I, have been telling my colleagues and my leaders that as soon as this vaccine is available, I want to take it when my turn comes around. I had no idea that, it was going to come so fast. I had no idea that I would be the first one in the U.S. To get the vaccine. I just wanted to take the vaccine.
So what? Your boss called you and said, "Hey, Sandra, we have the vaccine." How did it happen exactly?
So she called me Sunday evening and say, "Hey, we're getting the vaccine in tomorrow morning. Are you still ready and willing to take it?" And I said, "Absolutely." And that was it. And she said, "Okay, come in around 8 in the morning by the teaching center, which is where we're doing our vaccinations." And I just showed up, and I had no idea that I would be talking to you and so many other people about my experience.
So at the time, you had no idea you were the first in the U.S. taking it?
No idea.
You thought you were the first at your institution, though?
I know I was the first at my institution, but only when Governor Cuomo said, "You're the first in New York State and possibly the first in the U.S." did I realize the magnitude of what is happening.
So what's been happening since yesterday when news broke that you were the first volunteer to take it?
So since yesterday, it's just been, everybody wants to hear my experience. How does it feel? Why did you want to volunteer to do this? What is your message to people who are skeptical? And it's just opened up a good platform for me to be able to share my story and hopefully inspire people not to be afraid of the vaccine, but to be afraid of COVID-19.
There are a lot of people who are skeptical. They're like, boy, I'm going to wait and see a little bit. I don't want to be in the front line of taking this vaccine. Why weren't you thinking that way?
Because I've seen what life is like without a vaccine, what waiting and seeing could potentially do. Every day I would leave my home and I would look in the mirror not knowing if I would make it back home. And some days while working at the peak of this pandemic, that's how I felt. And I would take a picture every morning that I'm leaving in my scrubs. Sometimes I would share it with my friends and family, even back home, and said, it feels like I'm going back to war. Going back to war, don't know if I'll make it home. Love you. That's how I feel. That's how I felt. And in my 26 and a half years of nursing, I've never felt afraid until now.
You said back to war. No. Earlier, some months ago, I spoke to a number of Jamaicans who are also nurses working in New York, and it is accurate to describe you, because you're an ICU nurse, as being literally on the front line of this pandemic, correct? When did you... Sorry, go ahead.
No, you go ahead, I think.
I was going to ask, when did you realize the enormity of it in your ICU? What was the day you can remember when you said, oh my gosh, this is really serious?
It felt like an ambush overnight. I remember in March we had one patient, and we were just very careful about making sure that persons were wearing their PPE, personal protective equipment, and taking all the measures to prevent the spread. And it just seemed like overnight that we just started getting so many admissions. People were sick, gasping for air, and just the number of emergencies, and they were just rolling in and rolling in. We couldn't keep up with the volume. So I manage 4 ICUs and a respiratory care unit. Typically, the 4 ICUs at max volume accommodate 48 patients. We were up to 150 patients for weeks and months. And how were we able to accommodate that volume? So we surged into areas that were closed, conference rooms, into the adjoining children's hospitals, relocated other units so we could expand our ICUs, had to bring in, a number of nurses from all over the U.S. To help us out. So it was, I can't even describe what it was like. Nothing in my years of education in nursing could have prepared me for what we experienced.
You're listening there to Nurse Sandra Lindsay, first person in the U.S. It was reported to receive the COVID-19 vaccine. She's a critical care nurse and director of nursing at Long Island Jewish Medical Center in New York. My interview with her continues. Thank you very much for staying with us. Let's continue my interview with Jamaican nurse Sandra Lindsay, an ICU nurse who is now director of nursing at the Northwell Health Long Island Jewish Medical Center in New York. And yesterday was the first person in the United States to receive the COVID-19 vaccine. Describe for us, if you could, just to help people understand really what you're talking about. Describe for me perhaps one of your worst days, what that was like.
One of my worst days, there were so many, but it was probably about 6 o'clock, and after being there for 12 hours already, and the patients were just pouring in, and we had to open up another ICU. Now this was now going to be our 10th ICU, so from 4 to 10, and I just felt so weak, like my body was giving out. And I know that I had to be strong. I work with an incredible leadership team of nurse managers and assistant nurse managers. And one of my nurse manager looked at me and he said, "Sandra, I need you to go home. I need you to go home. You're breaking. And I know you, and I know you want to be here with us, but I promise you we'll take care of this."
Were you breaking?
And I went home. I was feeling weak. I was feeling a little feverish. And I went home, and I felt like I was going to die. I was afraid to close my eyes.
Of what? And just fatigue, or did you think you had the virus, or what?
I didn't know what was going on with my body. I didn't have a fever, but I think it's just mental and physical exhaustion. And I called my brother, who was my primary support person, my best friend, also a healthcare worker, so I know he could relate. And I said, for the first time, I just feel like, I feel like I'm going to die. I feel like I can't close my eyes. This is overwhelming. And, fell asleep, don't know what time, opened my eyes, and again, the next morning, put on my scrubs, looked in the mirror, said, "Thank you, God," and I was back again.
How did you do that after the night you just described? And your colleague obviously had looked at you and seen where you were.
Because people were showing up. They made sacrifices. They were committed, and so was I. And I know that I had a supportive team behind me. I know the work that needed to be done. I know I had to stay focused, and I know we have to beat this pandemic. So I was ready again. Maybe I just needed rest because it was 16-hour days, 7 days a week, non-stop. And, just seeing not just patients and their families suffering, but my staff, I felt helpless. And I just had to numb up myself Because if I allowed myself to really feel every single detail of everything, all the debt that was happening around me, I would have broken down.
Is there any patient you still remember?
Oh, yes. Oh, yes. Because although I'm the critical care director, it was all hands on deck. I was helping to get involved in the clinical care, providing post-mortem care. So I vividly remember all of those experiences. Because I'm the kind of leader, I don't ask my team to do anything that I wouldn't do. And I still love to connect with patients and be at the bedside and still learning, keeping up with my clinical practice as well as the administrative side.
So share with us, if you would then, that one or two patients who, really imprinted on your mind, who you still remember, who made such an impact.
So one of my nurses, and they're pretty young coming out of school, they had no idea the magnitude of what was happening. Not that they didn't have any idea of they know how to care for patients, but coming right out of nursing school, nothing can prepare you for this. And I remember him saying, Sandra, I've never done a post-mortem care before. And I said, come, let's do this together. And he said, are you sure? I said, absolutely. And I don't remember the name. There were so many, but just the face and us doing it together, it meant so much to him and it meant so much to me.
That's to your nurse? To your nurse colleague, you mean?
My nurse.
Okay.
Yeah.
What about, because I can hear you describing a position of administration, of you're doing a lot of overseeing, even though you say you are hands-on. So did you interact with families as well? And if so, do you remember any of those interactions?
Interact with families, so they couldn't visit because of safety.
Right.
But I remember this one young lady, husband was in his 30s, young children, and she was coming for what we would call an end-of-life visit before we took him off of life support. And that whole experience was just horrible. When she saw her husband after not seeing him for weeks, and when she saw him, it was just horrible.
Was that because of his state or his youth or what?
Because of his state, the multiple intravenous medications that he was on, life-saving equipment, it was just very overwhelming for her.
So how do you, as the administrator or the nurse then, what do you say? What do you do in a situation like that?
Sometimes it's just silence. Sometimes it's just being there. Because what can you say? What can you do? If they reach out to you to hold their hand, then you hold it. You kind of take the cue from what the family wants at that time. The same for my nurses, and other staff in my division. Most recently, I was passing by our clean supply room and just saw a nurse there. She had just done a FaceTime call with a family member who had passed away. She did the call right before he passed away just to say the family member wanted to see him before we took him off life support. And she just went into the room, sat on a garbage can and just started sobbing. And I just went in there and held her. And she kept saying, I'm so sorry, I shouldn't break down. And I said, why shouldn't you break down? What you just went through was traumatic. And I just held her.
Have you yourself ever broken down on the job?
Not on the job, but I remember watching our CNN special with our physicians. I don't know if you remember seeing that clip, and they filmed at our hospital at Long Island Jewish Medical Center in the ICU. Our director of the ICU, quite a few doctors spoke about their experiences there. And Audra Day's song, I Rise Up, was playing after that interview, and I just broke down. I couldn't stop crying.
It just brought everything back.
It just brought everything back, and I remember sending the song to my team and saying, "We will rise again."
Wow.
And so that's what I feel like. This is the beginning of that rise from taking this vaccine. So I hope when people see my face on television, social media, that what they see is hope.
You're listening to Nurse Sandra Lindsay talking to me from New York. We're going to take the break, and then when we come back, we'll hear a little bit more from Nurse Lindsay, including what she wants to do when she finally manages to get back to Jamaica. So we're going to be coming up with that. And just to let you know as well, coming up later in the program, remember we said we did want to talk a little bit about what facilities we have here in Jamaica to treat burn victims. Let's continue my interview with Nurse Sandra Lindsay, the Jamaican nurse, who yesterday was the first person in the U.S. to receive the COVID-19 vaccine. What about this virus has you saying you've never felt like this during your 26 years of nursing? What is it about the virus or how it affects people?
It's exactly that, how it affects some people and it doesn't affect some people. Why did I see so many young men and women in their 30s and 40s with no comorbidities die, and some patients in their 70s and 80s and 90s with multiple comorbidities live?
And you as a healthcare practitioner just doing all you can in every situation and not knowing what the outcome would be.
Not knowing what the outcome would be. And for staff, it was, they felt pain and suffering themselves because they felt like they gave it their all. And why couldn't I have saved that one? They're going through tremendous stress. They still talk about it. Why couldn't I have saved that one? And I say to them, we couldn't save everyone, but I know you did your best.
So what's the situation like now in your ICU? Because you are describing what it was like at the peak.
So for the second wave, we're seeing a slow build. We're about 25% of where we were back in April. And, we're prepped and ready to go. Obviously, we don't want to see anything like we've seen before. But if we have to do it all over again, we'll roll up our sleeves. I think that we've learned so much. The physicians, just treatments, etc., from our past experiences, and we are ready.
You sound strong.
I am built Jamaican tough.
Well, are you following what's happening here?
Sometimes I get to catch up, sometimes I don't. It's just really hard, especially over the last couple of months. But I was watching press conferences there, in the beginning. And I have to say, and I would say it here as well, that as a little country with little but with Talawa, I was incredibly impressed with the press conferences, the transparency, and the work that is happening there. So kudos to all the healthcare workers there and all the people who support them. Please, with your platform, continue to spread the message, positive messages, and just keep encouraging people. This is not a hoax. It is real.
But let me pick up right on that, because I was just in the supermarket over the weekend and somebody asked me that same question. Do you think COVID is real? So what do you say to the skeptics who remain?
It is real as it gets. Take it from what you've heard the experts, what the experts have been saying for months. Take it from people like me and others who have come out and spoke about their experiences. It is real. Why would we be making this up?
And you still have people who don't want to wear masks or raise questions about the mask wearing. Recently, we had one of our big artists, for instance, Buju Banton, speaking out against mask wearing. What do you say to those?
I say to people like those, and listen to the science, listen to the experts, listen to the science. The wearing of the mask protects you, and it protects those around you. And so I urge you not to give up. I know that it's exhausting. It feels like we should have put this away months ago, but we're still dealing with it. The light is getting a little brighter and brighter at the end of the tunnel. So just hang in there a little bit more. And in 2021, my hope is that things will be better.
Okay. So when do you plan to come back home?
Oh, I had a ticket for Christmas Day. I just had to cancel.
Oh, no.
Yes, as soon as it's safe. Right now, as I said, we're seeing the volume increasing again. And, at the advice of the experts not to travel, I have... my family and I have made the decision that we will celebrate virtually this year. But I hope by March, April, I will be there. I can't wait to feel that sunshine and to come home and eat some good food and go to some of the places I love and see a lot of my friends and family. I can't wait, and go sit under my mango tree in Clarendon. I cannot wait.
Okay. So what would you describe as your overwhelming emotion right now? Are you worried about the second wave, or is it more hope because of the vaccine, or a mixture?
Hope because of the vaccine, and a little bit of fear given what I know about the first wave.
Listen there to Nurse Sandra Lindsay speaking to me a little earlier this afternoon. She's a Jamaican nurse who made headlines all around the world yesterday when she received the COVID-19 vaccine. Now, the one she received was a Pfizer-BioNTech vaccine. The health minister said that's not the vaccine we'll be getting here in Jamaica. There had been concerns about that vaccine being transported to and transported within developing countries because of the need for very cold storage in terms of its transportation. That's not what we're going to be getting. News came today in relation to another vaccine, Moderna. Now, this one is also the regulator